Have you heard of the core? A lot of people hear about the core and they wonder, what is the core and how do I get a strong core? Well, I'm here to tell you all the features of the core today and what exactly makes it up and how you can start strengthening your core today in 3 simple, easy steps that honestly, if you really can't mess it up. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, and I am a pelvic expert physical therapist, and we help people heal their cores and strengthen their cores every single day. So let's dive in. What is the core? This fancy term that you probably have read in magazines, if you still read those. Sometimes you'll see it on social media. They'll talk about let's have a strong core and maybe show you some sit-up exercises or some planks. But the reality is the core is composed of 4 separate pieces, okay? So there is 4 pieces of the core. The top of the core, I'm gonna use a soda pop can to demonstrate exactly what the core is. The top of the core is composed of this muscle called the diaphragm. The diaphragm is the muscle that helps us breathe. So when we take a really nice deep breath in, our lungs are filling with air and our diaphragm is descending down into our bellies. It is contracting down. When we exhale, it recoils up. That is the top of the core, all right? Super important muscle. We use it every single day, every single second of the day with our breathing. We use it more aggressively when we're doing cardio or more workouts that really need us to use our respiratory system fast. We'll use the diaphragm then, but it's really important that we train the diaphragm in different directions. You might be more of a chest breather, and so you might not be using your diaphragm as much as you would be if you were directly breathing into your ribs or if you were directly breathing into your belly. So we're gonna go through some techniques to really show you how to use that diaphragm, that very top of the pop can. Now let's go to the front of the core. Let's pretend the front of this can, that is the front of the core. It's made up of the transverse abdominis muscles. You'll also have the internal and external obliques along with the rectus abdominis muscle. And so sometimes during pregnancy, especially, these muscles expand, or if you gain a lot of weight really fast, you're gonna get a lot of expansion of these muscles. And when they lengthen, they get weaker. It's called the length tension relationship. So longer muscles tend to get weaker, but we can keep working them and contracting them and working the range of motion of these muscles to help keep them strong if you're growing really fast, say during pregnancy. And now let me preface this. You can have a strong core at any size. So your body size, your BMI, which is complete BS, it doesn't matter. You can be any shape, size, and height, whatever. You can have a strong core. So it's not about that. I just tell you that when you're changing body sizes quickly, these muscles tend to get weaker. So it's really important that we use them more efficiently. Okay, so that's the front. So we're gonna mainly focus about the transverse abdominis on that front wall. Then you have on the top, again, you have that diaphragm. On the back of the soda pop can, we're gonna say that this is your butt muscles and your low back muscles and your mid back muscles that create your core. So when we're talking about these muscles, we're talking about the glute medius muscle, we're talking about the glute maximus muscle, we're talking about the rotators of the hip, we are talking about the lats that come down and pull our shoulders down and back, we're talking about the serratus anterior that helps keep our shoulders protracting and retracting, which means go forward and backward. And then also the lower trap muscles, which the upper trap muscles bring our shoulders here. The lower trap muscles help keep the shoulders depressed and also upwardly rotate the shoulder blade. So if I'm raising my arm up, the lower trap muscles are responsible for that. Those are the muscles of the back of the soda pop can. Now let's go to the pelvic floor. All right, this is the very bottom of the soda pop can. The bottom of the soda pop can is the pelvic floor. This is your pelvic floor. Your pelvic floor has 3 holes. It has an anus, it has a vagina, and it has a urethra. Urethra where we urinate out of, vagina for anything penetrative and delivering babies, and anus for bowel movements and passing gas. So it controls a lot of movement And the pelvic floor has to be able to control all those movements pain-free without issues. So when you have to pee, you pee. When you don't want to be peeing, it can hold your pee in. When you don't want to be farting, it can hold your farts in, and so forth, okay? So there's a lot of functions that happen at the very bottom of the core. This bottom of the core, it has to do many things. It has to be able to contract these muscles, it has to be able to relax the muscles, and it has to be able to overstretch the muscles, okay? We overstretch for things like bowel movements, delivering babies, and passing gas. Those are times we overstretch. Times we contract would be during orgasms, when we're exercising and we are even just generally walking, and times that we just want to be in a resting, relaxed tone are when we're sitting at our desk or when we're resting on the couch. We want to be at just that relaxed state of being, all right? So that's how the pelvic floor functions, and it integrates with the whole soda pop can. So the core creates this really amazing pressure, and this is why we use a soda pop can. This is an example from a very renowned professor named Dr. Mary Massery, and she has some incredible research that she has put out that uses and demonstrates this pressure that is created from a core. So when the core is optimal and strong, it creates this intra-abdominal pressure, all right? When you have this amazing pressure of the soda pop can, nothing can crush the can, or it's hard, right? So if I throw this can on the ground, well, it might explode, but I can't really crush it as well. But if I pop the top of the soda pop can, then all of a sudden, I can crush the can. I lost all that pressure, okay? So oftentimes it's the pressure inside the core that creates a really strong core. And what's really important in creating that strong core is knowing how to use the pressure so all the muscles work together and function together and help keep your organs inside your body and moving and ebbing and flowing inside the body, okay? So it's really important that we have this strong core. The role of the core is force absorption. And so when I'm going for a walk or a run, what's happening in my core is that when my foot hits the ground, my pelvic floor should automatically absorb some of it's called a ground reaction force. So the foot hits the ground, whoosh, comes the force. It goes up to my pelvic floor contracts almost like a spring, and then it leaves the ground and the pelvic floor relaxes, and it's moving and ebbing and flowing in the way as almost a piston, as a professor named Julie Wiebes would say, a piston, okay? So it moves, the pelvic floor moves in this piston shock absorption type movement, and it's moving with the diaphragm that is on top, okay? So if we have issues in the core, or our core is weak and we need to work on the core, it's not just building six-pack ab muscles. It's creating this 360-degree strength and intra-abdominal pressure relationship. What affects this relationship? Let's say you have a back injury. A lot of times the abdominal wall is going to shut down during a back injury. The glutes might shut down during a back injury. The pelvic floor might really tighten during a back injury. And so if we have that over tightening, we're not going to get that dynamic piston effect. So we have to work on relaxing and opening and releasing the pelvic floor. Many people, this is the key that they're missing when we're talking about core strength. They could be super fit six-pack ab athletes, but not have that ability to fully relax their pelvic floor. And if you're missing that ability, your joints are going to take a major hit. So if you're a high-level athlete, or you want to be, or you train like one, definitely get your pelvic floor worked on, because that's going to help develop new range of motion that's going to allow the pelvic floor to open in a different way than you've ever experienced. It'll also allow you to breathe deeper, because if you have more motion of the pelvic floor, then you're going to get more descent of that diaphragm, so it can help your vital capacity, it's called, which is the amount that the lungs can hold during respiration. So that can be really important. Working on the entire core, especially when there is back pain, or when there is, say, a pregnancy, and all of a sudden these abdominal wall muscles stretch out. That is when we have an insult to one of the barriers of the core. It's like popping the top, and there's a problem in that area. And obviously pregnancy isn't a problem at all. It's just telling you how it's changing, and with that change comes weakness and change in the intra-abdominal pressure and change in the way the core works, okay? I'm gonna give you 3 techniques or 3 must-dos, I should say, to really truly start retraining your core. The number one thing, see a pelvic expert physical therapist, no matter what. All right, that'll be a bonus tip, I guess, and I'll give you 3 other tips. But number one, a pelvic expert physical therapist can get your pelvic floor working in a way that you've never felt before. It'll open up your hips, it'll open up your back. So if you feel constantly tight or stiff, a pelvic expert PT who can really get in there and work the tissue is going to give you a new range of motion in your core, which will allow you to work it so much more significantly. So if you're deadlifting or cleaning, you don't want to have to think about, oh, I need to do a kegel when I'm in this mode. That's not a thing. We don't want to do that. We want to breathe appropriately to help hold our organs in and activate our core and activate the intra-abdominal pressure, but we don't want to be having to think about this. We want these patterns to become more natural. So that is the core, okay? So that's why seeing a pelvic expert PT is non-negotiable and super important. All right, the first tip here is we're gonna do a diaphragmatic breath. We are gonna learn how to work our diaphragm in a descending motion, which is gonna help train our pelvic floor in an opening motion. So let's do a hand on the belly, a hand on the chest. Take a nice deep breath here. Where did the air go in your body? We want to drive the air into our belly and not have the air go too much into the top hand on the chest. When this happens, you want to feel, if you can feel your vulva or your anus opening with the inhale. So we're gonna inhale in and exhale, recoiling, diaphragm's recoiling, pelvic floor is recoiling. Now, in order to really work the diaphragm, not just in the descent motion, but also in a 360-degree motion, I want you to imagine that if your rib cage was an umbrella, we are trying to breathe, so we open the umbrella of the rib cage. And actually, it's an upside-down umbrella if you really truly imagine the lungs expanding and getting the contraction of the diaphragm. So here we go. Diaphragm breath into the ribs. Exhale. Bring that air all the way to the back, all the way to the back of the spine, kind of where the bra line would lie. Deep that breath in again. Exhale and let it go. All right, so that is more of a lateral costal breath. So that was tip number 2. Tip number 1 is this diaphragmatic breath, really the belly breath. Exhaling. Then tip number 2 is this lateral costal breath, deep breath into the rib cage, and working that angle of the diaphragm. Tip number 3 is just going to be a simple transverse abdominis contraction where we learn to activate our lower abdominal muscles. So if you have your fingertips right in these hip muscles here, we want to feel like if your belly button is lifting up and in when you contract this muscle. So you're here. And then I like to do an exhale shh when I make that contraction. I use an SH sound. Shh. It's decreasing my intra-abdominal pressure and allowing that muscle, the lower abdominal muscle here, to contract even more. When I do that in that shh, and I get a little lift with that muscle, then I'm also elevating my bladder. There is a ligament that goes from the umbilicus down to the bladder called your urachus ligament, and that helps lift the bladder as well. Now, when we're doing this move, we don't want to be thinking Kegel. We don't want the pelvic floor driving this movement. We want to be able to isolate this movement with just the lower abdominals, with just that transverse abdominis movement. Okay, so that can be a helpful tip. So number 1, do diaphragmatic breathing every single day. I like 5 minutes a day. It's also extremely relaxing as it helps stimulate the vagus nerve, which is going to stimulate the parasympathetic rest and digest system and help avoid that sympathetic system, that keeps us on the fight or flight mode. It's really important that we tap into this diaphragmatic breathing, and that diaphragmatic breathing will keep us in that rest and digest phase, all right? And then equally, we go to the lateral costal breathing. Do that 5 minutes a day. And then number 3 is gonna be your lower abdominal, transverse abdominis activation, engaging that. And of course, the number one overarching tip of this whole thing was get in with a pelvic floor physical therapist, or a pelvic expert physical therapist, so you can truly learn to work all the ranges of your pelvic floor and even increase the range, which is gonna increase your core strength or increase your ability for your pop can not to be crushed. I'm Dr. Allison. I hope you enjoyed this video. Please like and subscribe. And if you have any questions, please drop them in the comments below and I'm happy to respond to them personally. All right, take care.